dates and goals together. Now I understand. If they cannot eliminate the whole thing, just get a passing mark. That's fine with me. You push the ball forward. It shouldn't be that hard. Second, we want IBI into schools. We don't want the kind of 2 days ABA, thank you very much, from Geneva. We want the professional trained IBI. If people in New Brunswick can do it, we can do it here too. If people in Alberta can do it, we can do it here too. And actually this thing is needed across Canada. The third point, ask for help. When you need help, I'm coming here and I'm asking for help. If all we can do is waiting lists and games, those are not political games, all the people have to come together here, everybody, to save those children. They need it. The third thing, ask for help. Ask from federal government for help. Call Mr. Tony Clement and say, sir, we're having a problem here in Ontario. We need more finances. We need guidelines. We need an agency to oversee this within the public health department. That's what we need. Somebody climbed up the stairs, he turned his head, I think it was a senior politician, I don't know his name, who he was, I know his face. He turned around and he said, well, he's just a protester. Yes, I'm just a protester, but I'm a protester with an autistic child. And I will be here as long as it takes for this government to commit on the record that those 3 things are going to happen. Also for my son, I know what I want exactly. I've been confused all along the years. I know what I want exactly. I want 40 years of IBI starting yesterday. Otherwise, I'm not going home. I'll stay here. And I'm not paying my mortgage. I don't need mortgage. I haven't seen a hearse pulling a U-Haul truck yet. I don't need houses. I don't need riches. I just want my son to be treated. I'll stay here. I'll bring my family and we stay here. And that's all I can say because it's out of line. The frustrations are so terrible. When I want to scare my things, I think of dark things, and I just don't really want to do that. I am very, very upset, but I do hope that these people here that are supposed to take care of, I know there is so many issues and so many problems, but the children is the first issue. Children are our is our riches. They're our gold. I cannot express this any better. I don't know how to do it. I don't know how to make it simpler. Communication is the problem. If the 3 ministries cannot communicate together for some reason or another, I suggest to them to ask help from the Ministry of Communications.
Okay, they can ask some questions too.
Sure, sure. Thank you very much. Thank you for listening.
I guess there's a couple minutes for questions if there's any questions.
Can you give us a sense of what it costs to purchase these services privately?
Approximately $40,000 a year for a 20-hour-a-week program. Depending on the child's severity, 40 hours a week, and there's a number of variables here. Stefan's son is nonverbal. My son speaks. There are differences between these children, according to their severity, and there are other issues like the aggression that Stefan talked about, so that those children would be needing a greater amount of therapy. So when you get up to the 40 hours a week, it's not double the cost because some of the costs are fixed. So the estimate about 40 hours a week would probably come in about $65,000 to $70,000.
Okay, we're going to share around the questions. Wait, Anne?
When you talk about wanting IBI in schools, what would that look like? Would the IBI be done actually in a mainstream classroom, or would it be offered in the school building as sort of part of a total education program?
It certainly could be. You know, we actually, when we were trying to make the point that it could be done, 2 or 3 years ago when Sandra Pupatello was Minister of Education, she told me to my face that it just can't be done in schools. Well, at least now they've recognized that it can be. I'd like them to actually get on with it. It's only been 4.5 years that they've been in power. But we decided that maybe it would be a good demonstration at the time to set up an IBI session for my son at one of our rallies. And we did that in the lobby of a hotel where we were holding the rally. The point being that if you can do it in the lobby of a hotel, you can certainly do it in a classroom. It is intensive. It is one-on-one. It needs to be done with certain parameters and conditions available. But the environment can and should change for our children, because part of the process is to very intensively teach a skill and then generalize it, to take it into a variety of environments so that the child learns how to use that skill in those different settings. So yes, it can. And the frustration here comes from, you know, there's one government program from one government ministry that another government ministry absolutely refuses to tap into. They've explicitly said that the educated, trained people with years of practical experience from the IBI program are specifically not allowed to go into classrooms. My school board has a policy that they are permitted in twice a year for 1 hour to observe only. They may not interact with the child. They may not comment on anything that the teacher is doing. Thank you very little.
Bruce, the waiting list that you have shown us, that chart, can you give me the numbers from 2003 versus the numbers from 2008?
2003, there were 78 or 79. Sorry, I didn't put them on the chart. 79 children in 2003 in Ontario, and I believe the figure is excuse me. I misspeak if I'm not careful. Yeah, 1,058.
And that's specifically for IBI in the classroom, or?
That is for the IBI program that is not allowed into the classroom. You see, this is part of the silliness of it.
IBI period.
That's for
That's for IBI, period.
Yeah.
There's special education funding that's dedicated to our kids in the school. Well, no, actually, let me rephrase. There's special education funding that's given to a school board because our kids go to school in that board. There's absolutely no requirement that the money that was given for that purpose actually gets spent on the kid. But there is money available to do this. It simply needs to be used on the best researched, scientifically proven, evidence-based way to teach children with autism.
So why do you think the money's not going where it should be?
Because they're barring the people who know how to do it. The Ministry of Education and the school boards are. They are trying in a very half-hearted way to reinvent the wheel. Let me put that in context. The original specifications for training an IBI therapist when the IBI program was started was 80 hours of work, 40 hours of classroom learning, followed by 40 hours of practicum hands-on, supervised with a child with autism for each and every therapist.